Hello, I'm Amy Hollingworth, the director of the Safe Sports Network, and I'm here today with Dr. Ackerman, and we're talking about sports nutrition and bone health. Thank you, Dr. Ackerman, for being with us today.
Thanks for having me.
Can you tell us what you think is the most important take-home point for athletes and parents or coaches regarding sports nutrition?
Well, I think it's really helpful if people are on a specific diet, so if they are gluten-free or if they're dairy-free or if they're vegan or vegetarian and have specific food limitations, that they absolutely see a registered sports dietitian. I think they can learn a lot. I've learned a lot as a non-dietitian by meeting with our sports dietitian and realize that those diets can be tricky to make sure that a growing kid, especially an athlete, is getting all the nutrients that they need.
Can you tell us, Dr. Ackerman, what you think a good takeaway point regarding bone health and minimizing injury is in regards to athletes and coaches or parents?
Well, I think that a few things for female athletes particularly is that they need to think of their period as a health sign. So it's another vital sign. It's normal for a young woman to get her period by the age of 15, and after that first 6 to 12 months it really should normalize, so they should be getting a menstrual cycle every month. Often when girls and women don't get their cycle every month and they've been very active with athletics, it can be a sign of relative energy deficiency. So there's a term from the International Olympic Committee called relative energy deficiency in sport, and it has to do with that mismatch between how many calories people are taking in and how much they're expending as an athlete, and one of the side effects can be the loss of menstrual cycle. The IOC then goes a step further and says that while obviously men don't have a menstrual sign or a menstrual cycle as a warning sign, they also can suffer from relative energy deficiency. So when people aren't fueling enough, they might have hormonal changes, and those hormonal changes can actually be detrimental to bone. So we need to make sure we're fueling enough to make sure that our bones are healthy.
Excellent. And you talked about different diets. What is your feel on the ketogenic diet, or what seems to be the buzz at the moment?
I think there's a lot of different buzzes, and there's different buzzes for different populations. So for example, in somebody who's a little less active and they're trying to lose weight, often getting off of a lot of carbs might have worked for them for weight loss, but for a really healthy active person, it's important that we keep all the nutrients in our diet. So having carbs, having protein, having fat is important. If we take carbs out and we take fat out, then we're actually cutting down on the muscles and breaking down the muscles that we need to be good athletes. So I don't really believe in trendy diets for most of our healthy kids, and when people want to try those particular diets, it can be helpful to be working with a sports dietitian to make sure they're doing it well.
Dr. Ackerman, can you tell us a good take-home point for healthcare providers in regards to bone health and minimizing injury?
I think doctors and other health providers should be aware that it's not normal for athletes, especially female athletes, not to get their period. When they lose their cycle, that can be detrimental to their bone health. And then for our male athletes, just because they don't have that period as a warning sign, they also can suffer from eating disorders or not getting enough calories in, and we need those calories and those appropriate nutrients to make sure that they're accumulating bone density and reaching their peak bone mass. So we want to make sure that the diets of our athletes are good.
Dr. Ackerman, can you tell us what you think is the biggest buzz around sports nutrition currently?
There's a lot of different buzzes depending on who you ask. Some people are into the ketogenic diet. Some people think that we should be vegan. Some people think that we should be dairy-free. I'm pretty traditional, and I think that there are a lot of benefits from varieties of food. Most of us need to be getting calcium and D. Most of us can tolerate dairy sources. Most of us can tolerate gluten. So I really think it can be helpful to keep a sports dietitian in mind when we're trying to get on specific diets and kind of stay away from those buzzwords.
Excellent. Well, thank you for your time, Dr. Ackerman, and have a great day.
Thanks, you too.